Can you hear me?
Yes, it doesn't go up.
Okay. So how would it work? Perfect. So hi there. My name is Sigvart, and I'm from CastPrint. And let me introduce you to the future of fracture treatment. Fracture treatment has remained the same for almost 200 years. Yet today still 90% of all trauma cases are being treated with the same old, big, white, heavy, uncomfortable plaster cast. What's even more troubling is that every 1 out of 3 cases register severe medical complications involving skin. And it shouldn't be like this. So we are solving this with the help of good old 3D printing by creating 3D printed casts that are lightweight, waterproof, ventilating, and custom-made for each patient. But more importantly, we have developed a solution that allows for hospitals today already to start offering 3D printed technology to the mainstream healthcare. Thanks to our cutting-edge technology, we have developed an easy-to-use process that integrates into existing trauma treatment processes in hospitals. And because of that, hospitals can save up to 15% on just patient treatment alone by reducing man-hours and materials and increasing the workflow in the hospitals. So that roughly translates for a typical public hospital, such as Perth, for savings more than 150,000 annually of euros of taxpayers' money. Now, these are not just words. We're already working with 4 private clinics and 2 public hospitals. And in fact, just last month, we received a formal confirmation from Perth that they are very interested in our solution and now making the paperwork in order on their side to make that happen before the beginning of the summer, to actually start already offering this solution to the Estonian market. And we have been growing each month, doubling in size in both revenue and patients we have helped. And up to this date, we have already helped more than 40 real-life patients. Now, our business model is that we do a subscription-based model for the solution, for the infrastructure in place, and so on, plus a transaction fee for each produced cast. And we are initially starting with the Nordic countries, where over 300,000 fractures occur annually. And afterwards, naturally, we will go longer in the Central Europe and so on. So this is only possible because of our team of specialists in healthcare, business, and technology. To name a few, our medical advisor, Dace Oling, has been the managing director of Roche Finland and Roche Baltics, to name a few. So we at CastPrint envision that fractures are just the beginning, and today, by working closely with the hospitals and being involved in their daily workflows, we already see the potential for our 3D technology that not just fractures, but also in the future, surgical planning, rehabilitation, as well as orthopedics, prosthetics, and so on. And so there are numerous opportunities to be in the future. So we are already the first end-to-end 3D technology company offering hospitals finally to be able to offer to the mainstream healthcare and people 3D technology. We're already working both private and public hospitals, and we have the necessary team to introduce this to the mainstream healthcare. We're currently raising seed round up to 300,000 to finalize our solution and expand in the Nordic countries, because hospitals from both Finland and Sweden have reached out to us directly that they want to see already our solution at their hospitals. So my name is Sigvart, and I'm from CastPrint. Thank you.
Second question is, how easy or how difficult is it to copy your products?
Thank you for your question. So naturally, competition there is. So 3D printing has been already for 5 years. Unfortunately, the biggest challenge was faced that in healthcare, you have a variety of stakeholders, and this process involves not just for them one software part or just printing part, and that's why it hasn't been adapted yet to the market. And so what we created is basically for the first year, we actually worked closely with the doctors, interviewing and creating the actual workflow process, how it easily integrates into the hospitals. And basically, this is what we create, and that's how we differentiate by creating this end-to-end full scope service, I would say. And that's what makes us different. And that's why it's quite hard to copy it, because it's a combination of both software and hardware, not to mention, naturally, the design and so on. And to answer your question about, competition, there has been around, naturally. Yeah, sure.
What's the benefits for the hospitals to use this type of?
So first of all, naturally, it decreases the man hours. So according to statistics, though, the current workflow, for example, to the hospital, so 50% of the typical fracture cases, you have to go back to recasting, and so after this control period. And afterwards, so usually depending on the trauma, for example, they need to do additional recasting, which can take from half an hour to an additional hour and so on. And this actually quite costs a lot for the hospitals. So with 3D printing, the casts are more durable, and they're actually quite easily removable, less than a minute. So it increases the both workflow and decreases the cost in terms of man hours spent for the hospital. And actually, of course, from the clinical side, it's much more, it's ventilating and that sort of stuff, which is also decreases the probability of medical complications during the treatment.
Where the actual casts are printed? In your office or?
Yeah, so currently, back in Latvia, so actually when we started out, we had our own printers on site in order to keep it in-house and learn more. And actually, in order to expand, it wouldn't be feasible to print it just in-house. So actually, we are developing this sort of solution, like a platform, to say that actually hospital, when they order, initially they go through us by creating this model. Afterwards, we directly relate them to this regional printing hub. For example, when you have an order from Finland, then naturally the model is created in Latvia, and afterwards it's directed to the nearest 3D printing center in Finland, which is then printed out according to our recipe and then shipped to the hospital in order to have the minimum of costs.
Scanning is done by the hospital?
Yeah, it's done by hospital. We provide the training and technical and that sort of stuff.
Science is very important.
Yeah.
So, can you show some science?
Yeah, of course. So actually, both us, so we have conducted clinical studies. So in both in Riga Traumatology Hospital, which is the biggest in Latvia, as well as numerous studies previously have been already carried out over the last 5 years. But the challenge was not about the clinical disputes, it's about how you can make it accessible for the actually mainstream healthcare.
Maybe last question. Is the technology yours? I mean, did you wrote your own software or
So the cast creation part, yeah, that's just by us, naturally.
How long it takes actually to get the hospital on board?
Sales cycle is naturally, it can take, for example, from private clinic, it's like 1-2 months. And from hospital, so in Latvia, it took us 6 months. In Perk, it looks like it will be much more sooner. So it can vary from 3 to 6 months, depending.
Okay, thank you very much.
Okay, thank you very much.
And you have made sales of 800,000 euros by now.
A little bit less.
Sales total revenue created 800.
Yeah, but not thousands, just 800.
800.
Just, yeah.
Thank you very much.
Yes, okay.